little bit about himself. And with that, I'll bring Dr. Ritz up. Enjoy the presentation. We'll have questions at the end. And thanks again for being with us.
I'd like to welcome you ladies and gentlemen. What I want to do today is talk to you about what the Ears, Nose, and Throat Department at KSB is doing for allergies. Prior to coming to Dixon for 24 years, I was a solo private practice ears, nose, and throat doctor in Morris, Illinois, which is not Morrison, Illinois. And I had as a subpart of my practice a workload of approximately 80 active allergy patients a week. And in the last 7 months, I've started developing a allergy practice at the Commerce Towers location. And I want to go over with you my approaches to allergies. And again, I'm full-time, 5 days a week at Commerce Towers. First thing that we're going to do is we're going to talk about what clinical allergies are. And what clinical allergies are is a abnormality, a pathology in the immunological system, where the immunological system should say that these foreign objects are harmless, but instead try to actively get rid of these objects. Allergy problems are incredibly common in the United States, and at one time or another, between 10% and 20% of the population has some problems with allergies, and of those, 5% need more than the over-the-counter treatment. What we're going to do is we're just going to spend just a few minutes going over what the immunological system does. In the last 30 years, there's been more progress in research and understanding of the immunological system than any other branch of medicine. There are, in an adult, 300 trillion human cells, and there's 10 times more bacteria in the human body than there are human cells. There are 10 times more viruses than bacteria than are human cells, and it's the immunological system that protects the human cells from being overrun by the bacteria and the viruses. Now, the bacteria are 100 times, 1,000 times more smaller than the human cell, and viruses are 100 times, 1,000 times smaller than bacteria. As part of the immunological system, there are cells that produce specific immunoglobulins, and there are literally, the body is capable of producing 10 million immunoglobulins that are matched to 10 million antigens. Antigens are on the surface of cells. They're usually protein. Sometimes they're protein mixed with carbohydrates. Sometimes they're proteins mixed with drugs. And they're usually on the surface of different objects. one of the basic questions for the immunological system is, number one, is what these antibodies contacting, are they part of the body or are they not part of the body? Now, sometimes what happens is the immunological system gets it wrong, and then you get these things called autoimmune diseases. And so that's where part of the immunological system says that this part of my body doesn't belong in my body and tries to get rid of it. And the most well-known autoimmune thing is rheumatoid arthritis, where the immunological system says some joints don't belong in the body, and then the immunological system tries to chew them up. The joints get red and swollen and eventually get partially eroded. A thing that's well known and for the last 10 years is multiple sclerosis. Is considered an autoimmune disease, and the immunological system says part of the white matter in the brain is foreign and we have to try and get rid of it. And then you get these spots on the MRI where the immunological system is trying to eat up parts of the brain. Other less known diseases that are common are lupus, and usually lupus involves the kidneys. If you talk about ulcerative colitis is the immunological system saying that part of the intestines don't belong, and they try to use the immunological system to get rid of what they recognize as abnormally doesn't belong in the body. Now, so let's say that the immunological system says that this is part of my body. Then what does the immunological system do next? The next thing is, well, if it's not part of my body, should I leave it alone or should I actively get rid of it? And an example of what's not part of the body, but it shouldn't actively get rid of, is foods. And sometimes what happens is the immunological system gets it wrong, and then you get food allergies. Now, what's more common than food allergies is environmental allergies, airborne allergies. And what that means is there are foreign objects hitting the surfaces of the eyes, hitting the surfaces of the nose or the throat or the bronchial tubes. And instead of leaving it alone, the body is trying to actively get rid of it. There are different parts of the immunological system that are involved in helping getting rid of these foreign objects. There are several types of white blood cells. One of the types of white blood cells is the basophil, and they're white blood cells that have little blue granules in it. And there are cousins of these basophils called eosinophils, and they contain red granules that are involved in getting rid of these foreign objects. We talked before about these antibodies, which is the first step in identifying what doesn't belong, and then they recruit in eosinophils and they recruit in basophils. Now, eventually what ends up happening is certain types of antibodies identify these future allergic particles, and they're called IgE. Now, when a person first comes to my office, what you do is you go through the symptoms and you take a history. Usually what ends up happening is most of the history is done on the initial visit, and the rest of the history is done on the second part. So if you're talking about regular airborne allergies, the symptoms that you're looking for is abnormal clear tearing of the eyes, abnormal itching of the eyes, some redness of the eyes, some swelling of the eyelids. In the nose, you have some itching in the nose. You have some bilateral nose congestion, not one-sided nose congestion. You have sneezing. You have clear nasal drainage. Again, it's clear nasal drainage, and it's not cloudy nasal drainage. At the beginning, the symptoms are vary from day to day, week to week, season to season, and time of year. And a classic example is at the beginning with people that have hay fever. They only have symptoms with increased ragweed pollen in the second half of August and September till the first frost. As they develop other allergies, it becomes different times of the year. So I'll give you an example with when they develop tree pollen allergy, it usually develops in April and May. Usually if it's grass and weed pollen allergies, it's more June, July, and August. One of the other things that you're looking for is if there's a change in environment, if they get symptoms worse. And so a classic example is they go over to someone's house that has a cat, and all of a sudden they get a great deal of nose congestion or itching, or they go over to someone's house and they have a dog and a similar thing happens. With food allergies, of course, you eat something and then all of a sudden you get hives or you get swelling in the lips or the mouth. What is a very common history that you get is other people in the family have had problems in the past with allergies. And about 50% of the time, when a person comes in with allergies, there have been other people in their family, either other siblings, parents or aunts or uncles that have had problems with allergy. And then if you're lucky, these people have had prior allergy tests, and if you're able to get the allergy tests, or if they're able to remember the allergy tests, that'll give you at least some clue about what they're allergic to. One of the classic signs of allergies is getting hives, and hives are raised, red, soft splotches. Over here I showed it on the hands and arms, but it could be on the face, it could be on the abdomen, it could be on the chest, it could be on the legs. Now, what we're going to do is go over what I call common allergy treatments, and you don't have to have a very specific identification of what you're allergic to. This is just a generalized treatment. So if you have problems with really severe allergies, and sometimes if they throw you into asthmatic attacks, or sometimes if you have this severe swelling called angioedema, what you should do is you should carry Epipens. Usually we recommend that you have 2 Epipens, and if you know that things are going to become bad, you take one at the very start of the attack, and usually within 2 minutes you should get a rapid response. Sometimes it comes back, and a half hour later you might have to give it again. Now, what I didn't show here is I showed you the adult Epipens. They also make pediatric Epipens, and if the child is 65 pounds or lighter, they probably should have the pediatric Epipens. After an 8-year battle with the Food and Drug Administration, the Food and Drug Administration in the last year has allowed generics to come in from Europe. It took the generic EpiPen companies 6 years of delaying tactics by the Food and Drug Administration to win approval. I'm very disappointed with the Food and Drug Administration doing an excellent job in trying to get the appropriate drugs approved and the appropriate genetic drugs on board. There's been a history of corruption with the Food and Drug Administration, and the last 4 head administrators of the Food and Drug Administration, a year after they finished their term, they're working for the drug companies that previously they were involved in approving or not approving drugs. I think that's a tremendous conflict of interest. What's happened recently is that there's been an emergency approval of recovery vaccines from people that have had COVID. A lot of the medical professions are up in arms that they've had emergency approval. The data says that they shouldn't have had emergency approval. What I'm hoping is that when it comes time to approve the vaccine, they're going to have an accurate assessment about if a vaccine should be approved or not approved, because eventually these vaccines could be given to millions and millions of people. Another thing that is good for airborne allergies, and again, you don't have to identify the exact airborne allergy, has to do with high efficiency room air cleaners. Usually the price tag is $80 to $150. What I like to do is I like to have that put in the bedroom of the patient, and make sure that the bedroom has doors closed, there's no open windows. The capacity of these bedroom air filters is such that if the bedroom door is open, they don't have the strength to filter out the allergens from an entire house. And again, way under $150. We're going to go over some non-prescription stuff to do for airborne allergies. In the short term, what you can do is Afrin nose spray, which is also neosynephrine nose spray. Again, this is very short term, only for the acute attack, should not be used for more than 3 days in a row. If you start using it for more than 3 days in a row, you get a problem with getting addicted to it and having to use more and more to have an effect. And I've known people that have started using it for 2 months, 3 months at a time, and they go through a bottle or 2 bottles a week. And one of the things, if you go through that much in a week, it'll raise your blood pressure, and you'll be wired and you'll have a hard time going to sleep. Again, this Afrin, neosynephrine, is short term, only for 3 days. What I believe is another over-the-counter nose spray that I recommend is a steroid nose spray. The most common one is Flonase or Nasonex. And it just, it's in the prednisone cortisone family. The good part about Flonase and Nasonex is it doesn't get absorbed by the body, and you don't get the same long-term bad side effects that you do with prednisone pills. And basically what that does is it reduces swelling. For children, usually it's 1 puff in each side of the nose, usually at nighttime. If that doesn't work, then I do it twice a day. With adults, I start off with 2 puffs in each side of the nose twice a day. If they have nasal polyps, I have them take it twice a day. A lot of times what I do is if it's a long-term chronic problem, I'll have them do it on a regular basis to get loaded up. Again, unbelievably safe, and absolutely it can be given to pregnant women who have problems with nose congestion. It's that safe. Again, what's been around for a long time is antihistamines. Antihistamines are what's one of the last steps in people developing symptoms of allergies. You have these IgE antibodies latch on to the allergy particle, and then these IgE particles recruit these basophils and the eosinophils, and then as part of the process to help wash away the allergic problem, they release a huge amount of histamine. Histamine causes inflammation. It causes the body to let loose of a lot of liquid, and again, it's to help wash away the allergy particles. The first in the family was Benadryl. The only bad side effect of the Benadryl, it causes sleepiness. Sometimes if I have a patient that's older and has problems with allergies and sleeping, I have them take Benadryl just before they go to sleep, and it's a 2-for-1. It controls their allergy symptoms, and they get a better night's sleep. what the more modern equivalent of these antihistamines is Allegra, Zyrtec, Claritin. They're each about 5% better. That's not a lot. Sometimes people that get used to one, sometimes I'll change them to another. Sometimes I'll get a little bit of improvement. Again, tremendous safety margin for Allegra or Claritin or Zyrtec. You probably can take 5 times the recommended dose and not get into problems. But again, you take the dose that the FDA says that's the dose you should take. And again, the original one was Benadryl. What is something new that has only been available for the last 2 years and that works completely differently than any other medications that we mentioned before is Dupixent. And what Dupixent is, it's a every other week shot, and it doesn't work on the histamine system. And what it does is it works farther downstream, it does not, it reduces inflammation, but at this point, there's no evidence that it does anything about having problems with reducing the ability of the body to fight infection, including virus infection, fungus infections, or bacterial infections. Right now, it, again, farther down the system, reduces inflammation. Right now, they're saying that even though it reduces inflammation, it's still, there's no evidence that it causes increased cancer. Because it's a new drug and it's very expensive, the drug companies would prefer to do anything outside of paying for this. Absolutely, if you had bad asthma and the most common 4 or 5 asthma medicines aren't working, then you can get approval. If you've had hives and they can't, and it's recurrent, and they can't find the cause of the hives, and it's occurring every week or 2 weeks, then they'll pay for that. If a person has nasal polyps, you can't find any allergic cause to it, and the person has too many medical problems that would result in otherwise needing sinus surgery, and they're at a high risk for sinus surgery, then eventually the insurance companies will pay for the Dupixent. And again, it's a shot every other week. A non-direct medication way to reduce the amount of inhalant allergies is saltwater rinses. There's 50 different kits. Basically what you do is you have a packet mixed and you mix it with some distilled water. You shake it in the bottle and you flush out the nose twice a day. And what that does is it reduces the amount of allergy particles that are in the nose and the sinus area. And again, over the next 12 hours, 24 hours, you're breathing in the same allergy particles. and the problem starts out again. Again, if people are anti-medication, these saline rinses are a good half step. Now, all the stuff that I mentioned before, you haven't identified what you're allergic to. If all these steps haven't worked very well and you're still having problems, then what you have to do is you have to go through the different steps to identify what you think the problem is. Identify what you're allergic to. And again, what happens is on the surface of these allergy particles are called antigens, and literally the body is exposed to hundreds of thousands of antigens. An example of an antigen is a ragweed pollen particle. And here's a picture of a ragweed particle. Let's say a very famous allergic particle is peanuts. And the classic example is the child doesn't know that he's allergic to peanuts, or takes at school some candy or food that has peanuts, and then he has a great deal of swelling. And basically at the first time it happens, the school nurse has to give him an Epipen. Again, of course, there are other things that people can be allergic to. And again, there's foods. Now, obviously, there's hundreds of foods. And what you try and do is you try and isolate as best you can what people are allergic to. Sometimes it requires critical thinking. About 4 years ago, I had a 40-year-old woman come to my office, and she said I've eaten shrimp all my life, and in the last few months, when I eat shrimp, all of a sudden, within a half hour, my lips start swelling, my tongue starts swelling, and my throat starts swelling, and I've had to go to the emergency room and get treated, and now I'm going around with an Epipen. So I said, okay, let's just make sure that it's shrimp, and you're not also allergic to other foods. So then what I did is I did my standard food allergy skin testing. And so part of the food allergy skin testing was peanuts and shrimp and milk and eggs and different nuts. And she wasn't allergic to shrimp. So then I said well, maybe something's happening with the technique that I'm using, or something's happened with my shrimp testing bottle. Let me send her for blood tests. So then what we did is we sent her for the blood tests. Blood tests came back and said she wasn't allergic to shrimp. So then what I said is, what I want you to do is I want you to come to my office with some shrimp, bring it in a baggie. What we're going to do is, my office starts at 1 o'clock in the afternoon. We're going to have you take it at 1 o'clock in the afternoon and see if you swell. Okay, and so that's what I did, is I had her eat the shrimp in one of my exam rooms. I had her stay in the exam room for an hour. Nothing happened. Then I had her go out to the waiting room, and by 5 o'clock in the afternoon, nothing happened. So then I said to her why don't you, defrost the same bag of shrimp and tomorrow have it. So that's what she did. An hour later, she said I'm on my way to the emergency department. So what it turned out to be, and look at the slide, she was allergic to the horseradish and not the shrimp. And so beforehand, she was having shrimp with pasta, and she was having shrimp and stir fry. And so what was changing is what she was having with the shrimp. So again, part of this has to do with critical thinking. Sometimes it's a little bit of detective work. Now, when we do allergy testing, there's two common ways to do allergy testing. The first way is to do allergy blood tests. And what the allergy blood tests do is measure the specific amount of IgE that the patient has in their blood system, let's say to ragweed, and also to mold, and also to house dust, and also to cat, and also to dog. Now, the other way to do it is to do skin testing. And so when we do the skin testing, what we do is we inject from some of these bottles some of the antigen, and we create little eighth of an inch mosquito bites. And these mosquito bites are actually little skin injections of ragweed or dog or cat. And then what we do is we wait 15 to 20 minutes to see if the mosquito bite gets bigger or if the mosquito bite gets smaller. Now, depending on how much bigger it gets, depends on if you're a little bit allergic, a medium amount allergic, or a lot allergic. Now, skin tests pick up about 15% more than the blood tests. And that has to do with the technical thing that when they do the blood tests, they only test for the most common IgE antibody to ragweed. Not every one, but the most common one. And when you do the skin tests, you test for all the different types of IgE antibodies to ragweed and not just the most common one. And that's why you pick up 10 to 15% more. Now, certain people, and in particular, kids under 6 years old, there's no way that they're going to let you do the skin testing. Other times is sometimes people have a phobia about multiple injections, and then you also send them for blood tests. Now, depending on how allergic you are, depends on what doses you're given. Now, when you have the blood tests, what they do is they also try and quantify how allergic you are, and that has to do with the IgE concentration. And when you show the blood test results, they break that down into is it less than 10 parts? Is it less than 50 parts? Is it over 100 parts? Is it over 500 parts? The higher the number, the more allergic you are. Now, again, what we're showing is the scoring system that we use. And what you end up wanting to do is you want to end up building a tolerance to allergy particles. And the higher the dose you give them, the more rapid they build up an allergy tolerance. Now, sometimes if you're severely allergic, you have to start off with a very low dose, and it can take 6 months or a year in order to really build up a high dose so they build up a tolerance. And over here is a worksheet that we do. Now, if they require shots, usually we do the shots about once a week. And we start off with a very low dose, and it takes 10 weeks to finish one vial. Then the second vial that we start is 5 times stronger. The third vial is 5 times stronger until we get to maximum concentration. Sometimes that can take 6 months or a year. Now, what is a very exciting development as an alternative to allergy shots is sublingual drops. So instead of coming in once a week to do the allergy shots, we do 3 times a day allergy drops under the tongue, and we give people a 90-day supply. Now, these allergy drops are approved of in Canada. They're approved of in Europe. They're approved of in Japan. They're approved of in China. The subparts of the drops are approved of in this country. So the antigens are approved, the liquid we mix is approved, but what's not approved is if you mix them and give it to the patient. Okay, and again, absolutely, the Food and Drug Administration, because of non-scientific reasons, doesn't give its seal of approval to give that, even though this has been given to people tens of millions of times in this country. And at this point, if people have some questions, I think now's a good time to ask them.
So I know on the Facebook Live, we had not had any questions. Zoom, does Zoom have any questions? So in the chat room, yeah. So yeah, so Doctor, I think we're okay with the questions.
Okay.
And thank you to everyone tonight that joined us. We certainly appreciate it. Please know that we will be monitoring our Facebook page here at KSB. And when we get those questions, we will be sending them Dr. Ritz's way, and we'll be happy to get you those answers should you have any questions at all.
Okay. Okay, thank you very much for inviting me. Okay, it's been my pleasure.
All right, again, thank you all for joining KSB Community Wellness, the KSB Foundation, as we continued on with our 5 senses theories. The thing that we ask you to do is stay in touch with ksbhospital.com/events, and you'll see a lot of other presentations that are also coming up. We'll continue with our census series. On September 8th, we also are continuing our brain health series, and we will be talking about suicide prevention. We'll have a couple of folks that will be sharing their own personal testimonies and experiences on suicide and suicide prevention. So again, that's September 8th. We can't thank you enough, Dr. Ritz. We are blessed here at KSB to have many great providers to share education with you as a community. And you're even getting claps out in the crowd for Zoom, Doctor. So thank you.
Okay, again, thank you very much. I'm happy to be a member of the team.
Thank you. Have a nice evening, everyone.